So today we're going to talk about the proper way how to start an IV. There are a few things in medicine and nursing that are as important as having proper IV access on your patient. Having proper IV access will allow us to give meds, administer fluids, and in rare cases you can draw diagnostic lab work. So the first thing we're going to do is get our patient set up here. So let me borrow your arm here. What we want to do is we want to look at veins starting from the hand, moving upwards to the arm. That way, in case a vein does blow, we can move upwards and sites up towards the arm. Jeannie here has some good sites to choose from. This is one of the easiest ones. This is the antecubital fossa, or the AC. She's got a nice vein here, so that's the one we're going to shoot for today. So the first thing we're going to do is go ahead and get our IV kit open. Every hospital has a different variation of what IV kit they use. They come with different things. So we're just going to go ahead and get this opened up here. And we're going to go ahead and apply our tourniquet. So the purpose of the tourniquet is to occlude venous return of blood from the hand back up to the heart. What this does is engorge the veins, and it makes them show up a little bit easier so you can visualize the vein that you're gonna puncture. So we're gonna go ahead and apply this tourniquet like so. And we're gonna wait just a little bit. Next, we're gonna go ahead and put gloves on. Having aseptic technique is also obviously very important since we're dealing with blood. Generally, we don't use sterile gloves for this procedure, but that's what we have here today, so that's what we're going to use. So, now that we have our gloves on, it's also kind of following the same thread as aseptic technique. We want to, after we visualized our site and we know where we're going to shoot for, we're going to kind of sanitize that area. These kits come with different kinds of cleaners. Today we're going to use an alcohol swab. What you want to do is you want to scrub up and down and back and forth. You want to make sure to get not just the vessel that you're shooting for, but also kind of the area of the skin underneath the dressing. That way everything kind of stays nice and antiseptic. So while we're waiting for that to dry, we want that to air dry. We can go ahead and get set up with the rest of our equipment here. One thing that we're going to need is a IV extension tubing. So we'll go ahead and open that up. The next thing is just a regular sterile saline flush. I'm not going to go into all the stuff about saline, but this is kind of what your blood is made up of, so to speak. And we're going to go ahead and take some of the air out of here, get it attached, and we're going to go ahead and flush this IV extension tubing. The purpose of that is once we actually get it hooked up, there's not a bunch of air in the tube to have to get out of the way somehow. What I like to do is go ahead and pop the top off of this and just lay it down. That way it's ready to go. That top can kind of be difficult to pop off whenever you're ready to use. So from here, we're going to go ahead and get our IV open. And again, these are all different from different manufacturers. So what we want to do is we want to visualize our vessel, and these are actually cut with a bevel at an angle so that it's a little bit sharper, goes in a little smoother, doesn't come out the other end. So what we're going to do is visualize our little vessel here, and it's nice and firm, and you just relax that arm there. Okay, we're going to pull the skin down just a little bit, and we're going to insert this at about a 45-degree angle here. And as you can see, you can get a nice blood return here. We're going to advance the needle just a little bit. Okay. And we're going to go ahead and attach our extension tubing. We're going to pop this tourniquet, and we're going to draw back just a little bit, and as you can see, we have a nice blood return here. So we're going to go ahead and flush that line out. Okay. And we're going to use a little bit of gauze here that these sets come with, just to kind of clean up our little area here. Want to make sure that the hub is screwed down tight. And from here, the IV is actually in the vessel, so we're good to go here. And we're going to take this little dressing, and we're going to apply it right down on top of our IV line. Okay. And from here, I would normally throw an extra piece of tape or two around there just to make sure that that side is secured. Afterwards, now that this side is secured, we just want to check in with our patient, check our orders, and make sure that it's good to go. As I stated before, you know, this IV site is going to be an excellent way to get drugs and fluids in per the physician's orders, and it would be hard to get by in nursing and medicine without it. So thank you very much.